I'm Dr. Mark, but today I'm a patient. I'm getting my flu shot. This is something every one of you should do this year, next year, and every year. The flu shot is your best protection from getting the flu. The flu is more than just an illness. It can be life-threatening in people who have pulmonary problems, people who have heart disease, older people. So I want you to do exactly what I am doing today. Get the flu shot. And by the way, the flu shot does not cause the flu shot prevents the flu. Roll up your sleeve and get it done.
Relax your arm, please. Thank you.
Is this gonna hurt?
Just a tiny.
She told the truth. It just hurt a tiny bit. Well worth it to prevent myself and to prevent yourself from getting the flu. Younger athletes need to make some modifications to their diet, but it's not too different from the dietary guidelines for other kids.
They may need an extra snack or two during the day, especially surrounding their sports.
Diana Schnee is a registered dietitian who works with children and teens who are into sports.
Kids tend to need a little bit more carbohydrates than adults. They're naturally burning a lot more energy than adults are because they're still growing. So especially child athletes are going to have even higher needs because they're growing and they're extremely active.
So what should an athletic kid's diet look like?
Breakfast, you're still looking at that good balance of a healthy carbohydrate with that's high in fiber, plus a source of protein. Lunch, same kind of thing, your well-balanced meal with a good source of a whole grain carbohydrate, so like a turkey sandwich, plus a dairy product, whether that's a milk or a yogurt, a piece of fruit, and then usually a side of vegetables would be a good healthy snack. Here's where it might get a little bit different. So if a child has a sport after school, they probably want to get in an extra snack within that hour or so before their event or their practice, just to add some extra fuel so they can get through that practice. Then immediately post-workout or post-practice, they're going to want to get in some type of easily digestible carbohydrate and a source of protein to start that muscle rebuilding process. And then dinner is going to look the same like it would for another child. Again, veggies, a good source of protein, potentially a fruit for dessert, and then your whole grains also.
So back to those snacks. What's best?
Fruit is going to be a great food to have around either pre, during, or post event. So bananas are really great, known for their potassium, and can be a great item to have after exercise. And also, you'd want to pair this with a source of protein. So sometimes we use chocolate milk or other lean dairy products. Berries are great to have, especially during practice, or if a kid has a long tournament during the day, because they have so much fluid in them, as well as just a good source of easily digested carbohydrates. We have some fruit granola bars here. Again, a great source of energy, probably more so for a pre-practice type snack. Just a good source of carbs with a little bit of protein. Also a little bit lower in fat. So fat is probably the one nutrient that we really want to avoid right before we work out.
When it comes to hydration, Schnee says sports drinks should be used sparingly and only when kids are exercising more than an hour. Water is best.
The rule of thumb is at least 4 ounces of water every 15 minutes. So if you think about a standard bottle of water, that should be gone within the hour. And it may need to be more than that if the kids are sweating a lot or if it's very hot out.
For Fox 8, I'm Dr. Mark.
We see a lot of coughs, especially this time of year.
Dr. Ellen Rome is a pediatrician at the Cleveland Clinic. Common causes of coughs include infection, acid reflux, asthma, allergies, and sinusitis. Dr. Rome says the #1 rule when it comes to kids: don't use cough medicine with codeine.
Some of us have not been codeine fans for a very long time. All of us are now not codeine fans. The American Academy of Pediatrics has noted that there were 3 deaths due to codeine in children in 2013. Those are 3 preventable childhood deaths. We'd like to not have another one. Codeine causes respiratory suppression. It gets metabolized to morphine differently person by person. And with children, that difference can mean an overdose. That can mean respiratory suppression and death.
It's really important to read labels as well.
I prefer non-narcotic, no dextromorphan, no nothing for any child with a cough, because Dextromorphan, like codeine, can respiratory suppress and pool those secretions at the bottom of the lungs. Dextromorphan shows up in combination products with DM. So if it says your decongestant DM, skip that one. That's not great for your kids.
Products containing pseudoephedrine should also be avoided in children.
Pseudoephedrine makes some kids revved up. It makes a rare set of kids sleepy. So I'm not a huge fan of pseudoephedrine if they're trying to give it at night to get the kid to go to sleep, and then the kid's bouncing off the walls.
Good options for kids? Dr. Rome has this advice.
Ones that have guanethicin, which is a cough suppressant, I think that's the one that's in Mucinex and a couple of other products, would be useful for and safe for children and adolescents. Cough care for kids includes supportive care and good old-fashioned common sense. If the kid is croupy, that barky, seal-like cough, then put them in the bathroom, put the shower on steamy, then let them sit there for 20 minutes breathing in the steam. Out the back door, let the cold air hit them for 20 seconds, back to the steam, back and forth and back and forth. Great thing for croupy cough. Steam in general can sometimes make people feel better. Tea with milk and honey, or even just tea with honey for those that are not milk drinkers, would be soothing. And you can do cough drops, just not ones that contain dextromorphan.
And when is it time to see the doctor?
Parents should worry if the cough is keeping everybody up night after night after night. By about that third night, maybe it's worth seen if things are getting worse, not better. If your kid has asthma, don't wait. With a bad cough, get that kid in pretty quickly, because with asthma, the cough can mean more than a cough.
For Fox 8, I'm Dr. Marc.
I never had any health issues, never went to the hospital except to have our 3 children, and was actually kind of shocked and in sort of disbelief when I got my diagnosis.
Mary Beth Zolik-Smith was first diagnosed with non-Hodgkin's lymphoma, large B cell, in 2012.
I had chemo and it went away for a couple of years and then came back. And then I had a stem cell transplant that didn't work.
And then I got a little panicky about what was going to be my next step, because there aren't a lot of options after that.
CAR T-cell represents a completely new and different way of treating cancer.
Dr. Brian Hill is a hematologist-oncologist at the Cleveland Clinic Taussig Cancer Center.
Instead of using surgery or radiation or medications to treat cancer, it's actually harnessing the power of the patient's own immune system, which is new and different.
CAR T is where they take your T cells out of your body, then they send them to a lab where they beef them up. They become your warriors, your T warriors, and then they reinsert them into your body, and they go right after the cancer.
The remarkable thing about this treatment is that it's a single treatment.
Patients need to stay in the hospital the entire time, up to 2 weeks, because of potential side effects like fever and low blood pressure. When Zolik-Smith received CAR T-cell therapy, it was still in clinical trials, but now the treatment is FDA approved for certain cancers.
I was in the hospital about 2 weeks at the Cleveland Clinic, and I came home, and then I went in for my first CT scan, and it was the greatest news ever. Dr. Hill came in and said, complete response. You responded completely. There's nothing there. We don't see anything.
One thing to be aware of is that this isn't for everyone. So this is, again, for patients only with the approved diagnoses of acute lymphoblastic leukemia, or ALL, in patients under the age of 25, or patients with a form of lymphoma called diffuse large B-cell lymphoma. It's also not something that we would do right away, but only if the standard approaches haven't worked. In those diseases, the likelihood of responding is somewhere between 50 and 90%, depending on which disease you're talking about. So pretty unprecedented rates of responses, and the potential for curing patients in which other standard approaches had failed.
Just knowing that the cancer isn't there is so liberating, and it certainly gives you a new perspective on life. Every day is absolutely precious.
For Fox 8, I'm Dr. Marc.